Thinking about retiring abroad? Panama, Mexico, and Indonesia have long been favored destinations among expats due to their cost of living and lively environments. While these alluring destinations have their charm, one crucial aspect to consider is healthcare. Embark on your journey with confidence. Whether it's the coastal beauty of Panama, the lively culture of Mexico, or the tranquil islands of Indonesia, ensure you have the proper health coverage to fully experience this exciting new chapter. In this video, we're going to take a look at the healthcare setups in Panama, Mexico, and Indonesia. We'll talk about the pros and cons of each system and figure out which health insurance options would work best for you. From public healthcare services to insurance plans with global coverage, we aim to guide you through it all so that you can relish your fresh start with peace of mind. Panama is an excellent destination for expats and retirees alike. It offers comfortable weather, affordable living expenses, and stunning landscapes. If relocating there is on your mind, understanding how the healthcare system functions and ensuring you have appropriate health insurance tailored to your needs are essential. A range of healthcare services are accessible in Panama. However, many foreign residents prefer private hospitals over public facilities due to their superior care quality, prompt service delivery, and added convenience. The public healthcare system is overseen by two organizations, the Social Security Fund and the Ministry of Health. They run clinics and hospitals nationwide to cater to both residents and foreigners. While the system is cost-effective, it grapples with challenges such as resources and equipment shortages, leading to extended wait times. It has the best hospitals in Central America that are affiliated with U.S. medical institutions like Johns Hopkins. These private healthcare facilities provide services akin to those in the United States or Europe, but at a more budget-friendly cost. If you work in the country and pay into the local system, you can gain access to public insurance in the form of CSS. The local private plans are much more affordable, costing $50 to $125 a month, depending on age and health, but with considerably less coverage, especially if you have any pre-existing conditions. For maximum coverage, international health insurance can be an appropriate option, costing policies between $2,800 and $5,700 annually. This will provide you with premium care in Panama and worldwide. A popular option for a U.S. citizen is the GeoBlue Explorer plan, for it offers worldwide coverage and access to the Blue Cross Blue Shield network in the United States. Deciding on your insurance plan depends on your individual needs, whether you're a retiree in search of extensive health care or a youthful expatriate aiming for fundamental coverage. Numerous expats have discovered that blending local and global insurance offers a rounded mix of protection and affordability. By securing a good healthcare scheme, you can direct your attention towards the things that truly count, savoring the lively culture, stunning scenery, and laid-back way of life that Panama has to present. Looking to retire in Mexico? Excellent choice! Mexico provides a way of life with numerous adventures and activities. However, before diving into your new journey, it's crucial to consider health insurance. Let's start with the basics. Mexico provides public health insurance that foreigners can join. The main option is IMSS, which stands for Instituto Mexicano de Seguro Social. Legal residents with the proper paperwork to live in Mexico can sign up for IMSS. The price depends on your age. For instance, people aged 50 to 59 pay about $63 a year. Those aged 70 to 79 pay around $93 a year. However, there is a downside. IMSS does not cover existing conditions, like diabetes or heart issues, for the initial 2 years, which could pose a challenge for individuals with health issues. Despite its affordability, IMSS may lead to waiting times due to overcrowding in hospitals and clinics. Additionally, the language barrier could be an issue since hospital staff may not be proficient in English. If you do not have IMSS coverage, there is another option called INSABI. It is a government initiative designed to assist those without insurance coverage. While it is budget-friendly, INSABI only offers basic healthcare services. Therefore, if you require comprehensive care, you might face difficulties finding options. If you fancy something a little more convenient and personal, private health insurance could be the answer. Yes, it is slightly expensive, but the value you receive is worth more than the cost you have paid for it. Private insurance is typically much more comprehensive than the basics. dental, vision, mental health, and even air evacuation if you have to return home to finish treatment. In terms of the cost, a good private health insurance plan in Mexico will cost about $5,900 USD per year on average. It fades more into a self-insurance of sorts, but it really offers an assurance that you're set in terms of insurance for almost everything that may occur. So, what's best for you? If you don't have any health issues and would like to save on expenses, then you can try to sign up for IMSS or INSABI. If you have health problems or you are one of those who just do not care for crowds and queues, then it might be worth paying a little more for private insurance. If you're an American, keep in mind that Medicare doesn't work in Mexico. Consider the Geo Blue Explorer plan or similar options instead. Having the right health insurance simply means that retirement in Mexico can be enjoyed without worry. You will be able to wander and marvel at the fantastic culture without being surprised by unmanageable medical expenses. Are you dreaming of a stress-free life in Indonesia, especially in the beautiful paradise of Bali? Understanding your healthcare options is crucial. Let's take a closer look at Indonesia's publicly funded healthcare system, known as JKN, short for Jaminan Kesehatan Nasional. This system is overseen by BPJS, or Badan Penyelenggara Jaminan Sosial, the agency responsible for managing healthcare services under JKN. As an expat, you are entitled to JKN, provided you have stayed continuously in Indonesia for at least 6 months with a valid residency permit. The deal is that JKN is going to provide very basic healthcare in public hospitals, which also get quite crowded, and the lines to see the doctors are simply very long. If you don't speak Indonesian fluently, as not all health workers speak English, it might be rather challenging to go through this system. This makes the public system less appealing for many expats who might be used to quicker, more personalized care in their home countries. Because of this, many expats prefer private healthcare services within Indonesia. Compared to public facilities, private hospitals and clinics have much better care and shorter queues. You are far more likely to come across English-speaking doctors, which is a big relief if you lack confidence in your Indonesian language skills. However, this better care comes at a higher price tag. Looking forward to private insurance provided locally, you would be talking of between $50 and $125 per month, depending on your age and health condition. While it's definitely much more affordable compared to what you may end up paying in the West, limitations may apply, especially if you have pre-existing health conditions. But if you don't plan on living full-time in Indonesia, traveler's insurance would probably be the best. This will definitely be one of the more budget-friendly choices, though most of them seem to want you to have a return date. It works out great for people planning on visiting family back home or staying part of the year there. For example, there's a plan that's going to cost you around $2.66 per day, adding up to about $970 a year, covering up to $25,000 for medical expenses and $250,000 in emergency evacuation cases. This sort of coverage is often enough to handle most medical situations you may have in Indonesia. On the other hand, if you plan on staying full-time in Indonesia and don't want to go through all the travel requirements, local private insurance is the way to go. You may want to look into international health insurance for your complete need for coverage. Yes, it's pricey, between $2,800 and $5,700 per year. It has really in-depth coverage that is not just valid in Indonesia, but also in the country of residence and elsewhere you may travel. Whether it is traveler's insurance, local private insurance, or an international plan, be sure to have some kind of coverage. Insure yourself properly for health, and you can now truly enjoy your retirement in Indonesia with the real knowledge that whatever life throws your way, you'll be well looked after. Thank you for sticking with us throughout this guide on navigating healthcare and insurance in Panama, Mexico, and Indonesia. We hope you found the information helpful and now feel more confident about the next steps involved in planning your new life abroad. If you liked this video, go ahead and hit the subscribe button. Make sure to turn on that notification bell so you do not miss any more tips and guides on how you can help your expat retirement to a future filled with amazing new experiences, safe travels, and happy retirement.